Was there any? Hello, everybody. We're going to go ahead and start our meeting. And if you have had a chance to look at your bulletin, you would see that we're going to go ahead and have our speaker address us. And I'm welcoming Dr. Sally Donlon, who's going to talk to us about women and children's health. But let me also, within the opening of our meeting, bring your attention to the fact that we've got some really serious things going on in the world with Ukraine and also the border between Afghanistan and Pakistan. I was in on the international meeting of the women having coffee this morning. And there's something that's happened at the border that I don't know exactly what the details are, but you might search for this. Whatever it is a sensitive issue. And it sounds like whatever it is something that may not be very good at all. In the meantime, a tribute to the women that are bringing their children in Ukraine, facing the conflict that's going on there. And as you know, that with Rotary, that we always, want peace, and we have the backing of UNICEF and the United Nations, and the foundation's working very hard to coordinate and do what we can. They're in touch with Shelter Box. Shelter Box is assessing. They may not be needed there because families are gathering up to help the people who are being affected by this conflict. So just keep them in your mind, and we're going to have a moment of silence. Amen. Let's all rise for the Pledge of Allegiance. Even though we don't have a flag, we know what it looks like in our minds. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And the four-way test: of all the things we think, say, and do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? All right, and so I am so excited about Dr. Donlon being here. The bulletins went out with her bio. I'm going to go over a little bit of this. Researcher, writer, editor, and activist, highly qualified through Dr. Donlon's work with the Louisiana Board of Regents, the Louisiana Endowment for the Humanities, and the Louisiana Bar Association. She's traveled throughout the state of Louisiana, giving her broad perspective and exposure. She's currently the Assistant Dean of UL's College of Liberal Arts. She is a founding member of the Creative Action Acadiana, and a Renaissance member of the League of Women Voters in Lafayette. She's an alumni of the Leadership Louisiana, Council for Better Louisiana in 1992. You remember other people, members of Rotary, have been through this program. The Institute of Politics at Tulane University in 96, and the Louisiana Commission on the Needs of Women. She's received her doctorate from UL in 2020 and has her master's in urban studies and public policy from the College of Urban and Public Affairs at UNO. And so it's my great pleasure to introduce Dr. Sally Donlon. Let's give her
Well, I guess I should sit since I'm being recorded, right? Okay.
Well, you can, or you can stand.
You want to minimize that little box now, Teresa, with the
Okay.
Okay, I'll
participants?
sit because it's more informal with
No,
you.
you just got right, okay.
And before, I've been asked to speak, and it's in here, but I've been asked to speak about women and children's health. That's what this is about. It's nothing political, okay? Although I've been involved in, and some of you probably have on other aspects of this that may be construed from this. We, all of us in this room, believe that the health and well-being of women and children in the US and in Louisiana should set the world standard. Specifically, no woman No woman should die from a preventable complication of pregnancy or childbirth, and children should live in a society that allows them to thrive and maximize to their full potential. Sadly, that's not the case. Women and children in the US experience higher rates of morbidity and mortality than women and children in almost any other industrial country in the world. Our rate of maternal mortality in the US is fully twice as high as rates in the United Kingdom or Canada, and it doesn't seem to be getting any better. From 2000 to 2014, maternal morbidity in the US more than doubled, while most other countries reported significant declines. Each year, more than 700 women in the US die during pregnancy and childbirth, and more than 50,000 pregnant women experience a life-threatening complication. And the point I really want to make at the outset here is that this important issue cuts across any sort of rhetoric you may hear. We can no longer continue to yell at each other to choose life or my body, my choice, if we are at all serious about improving outcomes for women and children's health. The real choice facing Americans is a systemic one. Women and children's health does not begin and end at childbirth. This crucial systemic issue must be addressed across all of the disparities that affect those outcomes if we are to make any headway as a country at all. Please do not misunderstand me. I was asked to speak to y'all about the state of women's and children's health in the US and Louisiana, and have come here to do just that. If you dislike any of the data I present, so be it. I assure you that when I am not the data-driven harpy that I may appear today, I can be just as charming as anyone. Unfortunately, the fact of the matter is that the US and Louisiana are lands filled with socioeconomic disparities. That should come as no surprise to anyone, but here is where we enter the house that Jack built. Because of these disparities, disadvantaged women enter pregnancy with fewer resources. For instance, disadvantaged women may have lower educational attainment and lower income and lack the emotional and financial support of a partner. They also have higher rates of pre-existing morbidity, such as cardiovascular conditions, obesity, and diabetes. Preconception morbidity leads to higher rates of pregnancy complications, including hemorrhage, infection, hypertensive disease, and premature delivery. 1 in 10 newborns in the US are born preterm. 1 in 10, that's a lot. How many of us are in the room? 1, 2, 3, 4, 5, 6, 7, 8, 9. And David. Okay, so one of us is going to be preterm. The highest proportion of any developed nation in the world. Prematurity is the leading cause of infant mortality and a contributor to lifelong morbidity. Thus, maternal health and well-being, reflecting experiences throughout the life course, may determine the health of the next generation and ultimately the health of the nation. Another challenge to maternal health is the fact that nearly 70% of pregnant women take prescription medications for acute or chronic conditions during pregnancy, yet very few of these medications have Food and Drug Administration approval for use during pregnancy. The lack of robust human safety data regarding the use of medications during pregnancy complicates the management of pre-existing conditions as well as illnesses diagnosed during that pregnancy, which may harm pregnant women and their fetuses alike. Children and youth in the US experience higher rates of poor health and developmental outcomes, including developmental disorders, mental health conditions, severe asthma, and obesity, as well as other correlates of poor health, including poverty, hunger, poor educational outcomes, and adolescent incarceration than their counterparts in other countries. Low-income children in the US have higher rates of developmental, mental, and behavioral health conditions and greater severity of these conditions than non-low-income children in our country and abroad. The impact of adverse health extends into adulthood, as young adults ages 15 to 24 in the US have higher mortality rates than their counterparts in other comparatively studied countries. The pattern of this increased mortality continues throughout adulthood. This underscores the importance of addressing the health needs of infants, adolescents, and children and young adults to improve long-term health outcomes. You can see where I'm going with this. It's not the pregnancy, it's the cycle that continues again and again. Many of us in Acadiana have become familiar with the great efforts being made by the United Way of Acadiana in their recent work in ACEs. Y'all heard of ACEs? Okay, this acronym stands for Adverse Childhood Experiences or Stresses in Early Life, such as child maltreatment, poverty, and parental loss that have been shown to affect health outcomes and are associated with morbidity and mortality during childhood. During adulthood. The prevalence of adverse experiences varies by ethnicity and socioeconomic status. Low-income children of all racial and ethnic categories have much higher rates of ACEs, but the deciding factor is generally socioeconomic conditions. Recent data from the Annie E. Casey Foundation's 2021 Kids Count data book demonstrates a systemic backstory all too clearly. Now, some of this is kind of complicated, so I'm just going to pick out the numbers from it, okay? In I didn't realize you had this. We could have probably put it up there. In 2010, okay, 22% of children in the US lived in poverty. 27% of the children in Louisiana lived in poverty. So even at that point, we were 7% higher than the US. In 2019, just a couple of years ago, the US rate of child poverty had decreased to 17. They had gone from 27% to 17%. So they had dropped 10% percentage points. We remained at 27%. We remained stagnant, our child poverty rate. In 2000, we're dealing with the same numbers, 2010 and 2019. In 2010, 8.3% of births in the US were of low birth weight babies. 10.7% were low birth weight here. By 2019, the US rate had increased to 8.3, they had to stay the same to 8.3. We had increased to 10.8. Okay, so they had stagnated and we had more low birth weight babies here. In 2010, 31% of children, they consider children and teens to be aged 10 to 17. 31% of US children and teens were overweight or obese. Same number here, 31% of Louisiana children and teens were overweight or obese. The difference was that in Louisiana, we had increased to 35%. So we're going in the wrong direction there as well. Now, here we get into education. In 2010, 66% of fourth graders in the US were not proficient in reading, and 82% of our fourth graders were not proficient in reading. Now, I don't know if you realize this, but in the fourth grade, whether you can read or not is one of the determining factors in planning when they look at how many prisons they're going to need in the next 20 years.
Are
Okay.
you saying that 82% of kids in Louisiana cannot read?
I didn't say they can't read. I said they're not proficient in reading. That means that they're not functionally literate at fourth grade. In education, what you say is that you learn to read until the third grade. By the fourth grade, real reading instruction ends, and you're supposed to be able to read to learn. Okay, you're supposed to be able to pick up a book and essentially teach yourself. Okay, and we failed miserably there. Okay, then if you look at math, okay, in 2010, 67% of eighth graders in the US were not proficient in math either. We're not the only ones. It's just that we're not catching up as much as the other states are. 80%, 67% of eighth graders in the US were not proficient in math. 80% of eighth graders here were not proficient in math. So we're not good in STEM either.
What is that definition when you say proficient in math?
That means that you can't, if you were given a regular word problem, you couldn't figure it out yourself. How many cantaloupes would it take? Right? You'd have to have assistance. Okay. Now, US rate decreased. Well, they stayed the same. They were 67%. They're still 67% across the US. And we improved also. We went from 80% to 77%. So you see slight increases in math, but if you look around, you see all the effort and money that's being thrown at STEM. And we've seen some improvements, but 3%, right? So we're throwing money at the issue, but we're not getting a lot of payback for it, okay? So these educational rates are systemically important because they feed the systemic inadequacies of the healthcare system. children who grow up with these educational limitations will have scant access to the systemic health care on which all of our overall health depends, and quite frankly, on which our overall economic success as a region depends, right? These are the people who, in the College of Liberal Arts, when we talk to our new students, we talk about college education or other higher education. It could be a technical college, right? Leads to longer life. Why does it lead to longer life? Because you have more you have more opportunities to acquire health insurance, all of those things that lead to health care, right? If you can't afford that, then your health is going to decline and you're going to have a less productive life. Less productive life means less productive communities. So it's not just the problem of the individual, it's a problem for the community. So that's part of where my systemic reliance comes from. So the importance of accumulated life course experiences on long-term health and well-being is supported by a large and growing body of literature. Many women enter childbearing age with lengthy histories of ill health and adversity. They've come from this cyclical, many cycles back, right? Often beginning during childhood. During pregnancy, the accumulation of poor health and adverse experiences affects the interuterine growth, emotional health, and nutrition status. For women and children, the systemic access to medical care is one buffer against poor health. However, disadvantaged women experience limited access to care and are more likely to have an unplanned pregnancy, partly reflecting inadequate preconception care and family planning. They are more likely to start prenatal care later because they don't have access to insurance, and more likely to start prenatal care likely than their more advantaged peers, and to deliver in hospitals with a lower quality of care standards. To achieve the health standards for women and children to which we all ascribe, we must abandon this binary choice of birth or non-birth, right? You either have a child or you don't have a child. We must create a healthcare system that enables every woman who's going to have a child to bear a healthy child. Okay. Because right now the data show that this is not the case. And just making women have children is not going to have a healthy child that's going to contribute to our society. We must apply a life course perspective from preconception to pregnancy and at all life stages, including fetal development, childhood, adolescence, and adulthood. This perspective promotes family-centered design and equity by acknowledging and addressing the adversity and disparities across the life course. We must build broad programs to achieve access to health, access to education, pathways out of poverty, and to integrate healthcare with the other sectors. Right now, the way we look at things is siloed. We have education here, we have healthcare here, we have criminal justice here, and they're all here. I mean, I know we're all aware of this big, what happens is the news media and politicians get a hold of these slogans and they run away with it, right? So we hear this thing about defund police, and the right makes it theirs, the left makes it theirs, and all of a sudden it has no bearing on what the original intent was of those words, right? So this is when someone originally said defund police, they meant nothing about taking money away from the police. They said, let's take all the money away from here and spread it across these silos and integrate it, right? And all of a sudden, months later, nobody has any idea of what the original intent of that was, right? So I think, part of my message is we at the community level need to take that back and say, look, man, just stop being goofy and work with our communities and say, we know what needs to be done. We need to de-silo, maybe not defund, de-silo and spread it out. We know what needs to be done. We need to integrate everything and make sure these groups work together. I mean, when my daughter, you said you have young children. When my daughter was at Lafayette High, she has suffered from migraines. It's in my family. My brother came to ostensibly help me over the weekend. For a day and a half, he couldn't help me because he was suffering from one of his migraines. My father had it. My grandfather had it. Luckily, I'm growing out of it, right? But my daughter suffered from migraines. She couldn't get in to see the nurse. There were not enough nurses on staff. They couldn't keep her medication, right? So she had to miss school. I had to keep her home and take her to see a doctor every time she had a migraine, even though it was an acute condition, right? Now, that's not an example of these silos working together.
That's way before COVID.
Oh, that's way before. You can't blame COVID on that. These are just these individual silos working separately to the non-benefit of families, right? So where was I? In short, we must do what other developed nations do. Ensure that women, their partners, and children have access to high-quality comprehensive health services across the life course. Care should be patient, family-centered, and should emphasize preventive services with culturally and linguistically appropriate outreach and services. Insurance plans to be considered insurance plans at all must provide maternity care, mental health care, and women's preventive services. And we ought not allow exemptions for contraceptive services. Okay. All children should have access to healthcare services that emphasize the prevention of adversity and ill health. Coverage should ensure access to behavioral and mental health and oral health services. Children with special healthcare needs require integrated, coordinated care and habilitative services. Another personal example, I grew up with what do we say today? A younger brother who was multiply not disabled. Anyway, he had multiple needs. Okay, he wasn't born that way. He had infantile meningitis, right? But because he had these variety of special needs, I mean, it was a nightmare jumping between the health agencies, right? Because he had cognitive issues, he had physical issues, and they kept bouncing us from agency to agency. We're a relatively well-educated family. I can only imagine what it would have been for families who did not have the educational resources we had. We didn't have monetary resources, but we had relatively, good educational resources. But for people who suffered from those other educational deficits, I don't even know how they did it. And these are things that I've experienced personally. I imagine that many of you, if not personally, the members of your extended families or friends have experienced these things as well. I mean, it's no mystery. We know it's out there. The easiest and least onerous way to do this is to strengthen public insurance as it is practiced in comparable developed nations whose citizens enjoy far better health outcomes for children, women and children than our own. In the US, now I say this because in other countries because it's a structural issue, okay? There are systems in place. In other countries, there's a public insurance plan and it's structured that way. In our country, there is already, like the veterans had the Veterans Administration. Our public insurance health plan is provided through Medicaid and CHIP. Okay, you're familiar with CHIP? Okay. And we can affect structural changes such as I've been discussing with you along 3 fronts using our existing system. Okay, 1, Medicaid could ensure universal coverage for all children from birth through 21. We kind of did this, we extended a little bit, and my daughter was able to access my private coverage through the age of 26, okay, as long as she was at university. So that was a huge help for us, right? Because she didn't get launched until, she wasn't launched when she got out of college, right? So extending that was a big help. And we were able to do that through our private insurance company. Okay. Second, Medicaid for children and youth could transform to a fully federally financed program to reduce the burden on states and facilitate the development of national standards with physician payment rates comparable to those of Medicare. States often struggle to balance their budgets, which is related in part to the fact that Medicare consumes a sizable proportion of the budget, on average 15%, maybe more for us. And because demand for services increases when revenues plummet, such as during COVID, now this is definitely related to the COVID pandemic, federalizing the Medicaid program for children and youth would generate some additional costs. However, at this time, the feds only dedicate 10% of the federal spending on healthcare to children and youth. That's not high enough, okay? And a new program could be gradually implemented. Under this construct, families could maintain employer-based insurance with the understanding that the federalized program could support them as needed. Similar to what like at my age, I'm nearing retirement. So my Medicare could kick in as a supplement to my personal private insurance as needed, because I'm more prone at my age to additional insurance needs because I'm older, right? Things start to fail more, right? But extend this to children who at that younger age, at the other end of the distribution, they have those occasional higher needs too, right? Older folks and then younger folks. Third, Medicaid could expand its focus on population health, including focusing on upstream prevention of poor health, incentivizing transformation of healthcare, and promoting cross-sector collaboration. In the long run, we will pay for healthcare one way or another. We can choose to support an integrated system that will increase positive health outcomes for women and children and contribute to a healthier, more economically successful society. Or we can choose to support a failed system that focuses on the bent screw in a broken down engine. The data is clear, the system is ours, the choice is ours. Thank y'all.
Thank you.
Comments, questions?
Can you hear me? This is Quincy.
Yes,
Hear you.
Quincy, I hear you.
Yes, I want to ask you a question. You're at the university, right?
Yes, sir.
What department?
I'm an assistant dean in the College of Liberal Arts, and I also teach an early American literature course, which is very interesting.
Right.
Because
Okay.
I'm asking
Well,
them to look at what's happening in Ukraine
Right.
as we
Right.
study the revolution.
Right. Well, I'm in the music department here at UL. Okay. I wanted to ask you a question, not a question. I want to clarify. I want to make sure I heard what you said. You said by the time the kids reach 4th grade, they should be able to read enough on their own to carry themselves. Okay. And then you said, what was about the math when you said, I missed that one. You said by the time they reach what grade? Math?
8th grade, by the time they get to 8th grade, because remember in 9th grade, they're getting into algebra.
Right.
So if they
Okay.
don't have basic mathematics, which is what we call arithmetic, the
Right.
rest of the
Gotcha.
world calls it maths.
Right.
okay?
Right.
If they don't have basic maths by the 8th grade, they're
Mhm.
gonna fall off into algebra and be totally lost.
Okay. Now, didn't you say something about by the time they reach 4th grade, if they haven't learned that the prisons or something, they decide how many people are gonna go to prison or something?
Oh, well, they've been looking at this for 40 years now. Planners, long-term planners look at the number of students who, the percentage of students who cannot read enough to educate themselves, like picking up an instruction. You hire someone, you give them a safety manual,
Right. Right.
okay? If they cannot read that safety manual and keep themselves safe, that's what you
Right.
consider functional literacy. If they
Okay.
cannot do that, then they look at those percentages of people who can't do that, and they project the number of prison cells that they're likely to need 20 years hence.
Okay. That's cool.
Because if they
I'm not
can't
saying,
hold a productive job, the likelihood of them doing something unproductive
right.
increases.
Makes sense. Makes sense. I just wanted I was trying to hear it and then listen to some other stuff too. So, but anyway, thanks a lot. I appreciate it. Thank you.
Yes, sir. Thanks, Quincy.
No problem.
Question. I know you were saying that the money should maybe go to the elderly people and then maybe the younger people. Is it money for healthcare or more for education to pretty much help them understand what they need to do to stay healthy? Because I was under the impression that usually the younger people are the ones who need less insurance. You know, like when you're buying insurance, it's much cheaper to cover yourself and kids than a spouse for the reason that you said. So I'm just kind of wondering what you see that pocket of money that you want to grow.
Well,
focused on.
actually what I said was I used the model like when I'm the second prong was to increase like Medicaid, like start it when they're very young and just keep it through the age of 21, because there's so many things that can go wrong with children all the way through to the time they're 21, right? And I use the same model as how Medicare will kick in with me, okay? And it did kick in when I turned 65, okay, although I'm past 65, Okay, but although I'm still working, my personal private insurance is still in place, right? But I have this supplemental I can call on. I can call on my Medicare, okay, if I have greater needs, okay? So even if you have personal, so they're calling on a public, the model would call on public insurance to be in the background. So even if someone has personal private insurance, Medicaid would be there as a structure to be called on to the level that you need it. Okay, if you were your level of poverty would be high, then that Medicaid chips would be your main insurance. But if you were less poverty, a lesser level of poverty, your private insurance would kick in, but the chips would always be there in the background to fill in whatever gaps if you have a catastrophic childcare issue. Like my little brother wasn't born with a problem. He got ill after he was born. So if his access to chips was dependent upon how he was born, right? But at 2 or 3 years old, which is when autism typically manifests, right? You could call on that chips that's hanging out in the background as supplemental if it was structurally set up that way. Is that kind of clear? Yeah.
Not to put you on the spot. I know you ran off statistics over a 10-year span, but do you know at least approximate what those numbers look like, say 30 to 40 years?
I really don't.
And if there's been like a trend
Mhm.
and what might have attributed to that? I was just curious.
Well, I mean, I do know a lot about education, and there's been slippages in education, a lot of slippages in education along the way, unfortunately. And I worked in that area for 12 years with the Board of Regents, big grants, and there's been, there's been fewer and fewer reading. Well, let's see, not to get into the weeds too much, but there's something called the reading wars. There's infighting. I'm sure I don't know what your field is, but there's infighting there. I don't know what your field is, but there's infighting there. And in education, there's infighting. How do children learn to read, right? Children are going to learn to read, but they're going to learn to read it how they learn to read. But what happens is administrators decide this is how children learn to read, and they impose this, right? And there's this great thing called the great distribution, right? And so whatever dollar you pick, there's going to be some students that learn it this way. And then what happens is the students who are at either end of the distribution tails get ignored. So for years, there's been an effort to do individualized instruction to pick up these tails. But that's what the funding tends to go there. They just throw more and more funding at the center.
Well, we are so privileged to have you talk to us. And as a speaker for our Rotary Club, we have a little gift to give you. It's a sand dial.
And she's telling me I spoke too long.
So now you can put it on your desk and see how the time's passed.
All right, thank you. And I appreciate you letting me go first. I advise an honors session at 1 p.m. Am I on time?
Yeah, you're good. Just a few minutes after 12:30.
Okay, great. Well, thank y'all so much. I did enjoy it.
Thank you so much. Drive careful.
Okay.
Well, we're gonna have to go on with our meeting. And I thank everybody who's here. We have a good representation, a good room that's filled with people, and good to have everybody who is actually online joining us.
I know I messed up earlier. It's your little box. How do you get rid of that?
The little box.
So this, it's covering the,
I don't know. There, you just touch it.
okay, I was afraid to. All right, and now you detecting
Oh,
problems.
we got some problems going on. We don't know what it is, but we hope you can still hear us.
Got rid of that.
All right.
Thank you.
Thank you.
My little son, I really do.
Yeah, don't forget that.
Don't forget your glasses.
Bye-bye.
Bye-bye. Thank you.
Thank you. Right.
All right, so
Yes.
we're gonna go back to our regular agenda for the meeting, and so I'm going to ask if Yolanda, if you have anything you would like to present,
I do not.
okay? Michael, I think has a short treasurer's report for us.
So all the Super Bowl pool funds, that's all been paid out. So we're all situated, squared up with that. I did last week.
Must have spent it.
Yeah, check your cars. Right now, the income for the year to date is about $4,000. Want to remind everybody too, that includes the $1,500 kind of, don't want to say refund, but the return of funds related to the scholarship from last year. So if you take that out of the equation, it's about 2,500 is where we're sitting for net income. Funding of the future scholarships, we've got that in the budget right now, but want to make sure everybody gets their auction items in, give them to Greg so we can get our website updated. I've got a couple of things.
Time is short.
Yep, and that comes up, what, starts on the 14th of March, if I remember.
Starts like Monday at midnight.
Yeah.
I've got night meetings every night this week, so if you don't get them to me by Friday, really unlikely that they're gonna get on the site in time.
So, heads up for everybody on that one.
I don't need the actual item, just the sheet that describes what it is, cost, photo, that kind of
Okay.
And then from the cash balance, we're sitting pretty well. Both our savings accounts, the CD and the savings account is about 10,000 each. And then the main operating account has about 26,000 at the moment. I know some of that's going to get paid out with our grant match and all that stuff, but overall, sitting good financially.
Okay, sounds really good. All right, when I look through this, I want to share with y'all that we will be having the Go-Go Bibliomobile coming up tomorrow. And also with regard to our grant, we're in the process of setting up, we've actually defined where the benches will be. We have them marked, they're squared up, and essentially I'm expecting to get one more or more input from the cement expert, concrete expert regarding what we need to do with these particular benches, whether it would be better to form up ahead of time or after. He's going to be in contact with our manufacturer. But both options are available at this point, and if there's one preferred over the other by the manufacturer, that's what we'll probably try to do. But if it's even, then we'll probably try to go ahead and form up sooner rather than later to allow the curing. The auction items. Greg just talked a little bit about it, so let me share that the auction is March 14th through the 18th. That's this next Monday. It's going to begin. So go ahead and get your options into him. We will send that information again online. I think that a lot of items are flowing in. I know that I've got a few that are still coming together. And the sooner we get it to Greg, the better off we'll be. The other item to consider is talk to your friends, talk up this auction. It's, you know, we can have everything wonderful in the auction, but if we don't have bidders, we're going to have a problem too. We do have this on with the URL, and some of our auction items are on our bulletin board on television set in the morning. So that's going to help, hopefully. And then, like I said, get with your contacts, build on your network, and get some excitement going on also through Rotary. I mean, our Rotary folks are, you know, they're our best customers.
Teresa, if I could, it'd be very helpful if every club member looks at the site and let me know if you see something doesn't look right. Teresa's been good about proving some of the numbers. Danny's found some errors that I put in there. So please look, especially if it's an item you secured, make sure that the description is right and it looks like the thing that you got. That would all be very helpful. And please put the URL in the Facebook page if you've got one. Let everybody know.
Can we get that, a post on our site, that we can maybe share?
Yes.
Yeah. And you know, I was just thinking too, to help out, I can throw a few bucks in on an ad. I think I may have done it last year. I don't remember if I did or not. But sometimes we'll just take a post and then turn around and run it, or I'll just do something separate. But I could basically just send people to the website, and I could run that a few days leading up to the auction and let it run during the auction, and just try to get more eyeballs across the community.
You
Okay,
can also use the bulletin board here, right? For
Mhm.
the AOT.
Yes.
You guys already discussed that.
yes,
And so-
with other things that we do, anything that we want to have, promotions on. Amy,
Where's the URL? Is it on the bulletin?
it's on our flyer.
Okay, so
It's on the flyer that went out
the
and,
one that Brian did.
yes, and we put it on the bottom quarter. The first one that he did not have the URL on, but there is one now that has the URL on the flyer. And have some in the car if you want, to give you some, I'll pick them
Okay,
up.
also,
before you leave.
do we know where we are with items?
40,
We have 40?
What did we have last year?
57.
So we're getting close. Okay.
Okay,
Then come over the weekend.
40, everything I have to date is 40.
and I know that there's more coming, definitely.
Quick.
Okay. All right, another thing as far as going back to the grant and the scholarships, that all of our reports that are needed, essentially, we've gotten reports in. Our grant is not finished yet, but the district is aware of the problems as far as getting the bench in. And as long as we just keep them, updated on what the progress is, I'll be putting together, I've got like a report put together already, but I'm going to expand it with photographs.
I'll put a call in again tomorrow.
Okay, great.
Teresa, I think the deadline for next year's district grant application is coming up soon,
Yeah, I think doesn't it come through in late April and May?
or early April.
Oh, okay. Well, I'm not sure. I know Lauren's watching that closely.
Yeah, I was gonna say Lawrence on top of that.
Yeah. We will be meeting with Oakborn tomorrow, Lauren and I, about the cost. And we have essentially discussed and are going forward with having a live meeting on the second Tuesday and having a virtual meeting.
Reverse that,
First, yeah,
first Tuesday.
live on the first and the
Right.
second meeting virtual.
The second Tuesday. Okay, the first Tuesday is always our board meeting.
Oh, I thought you were talking.
Yeah,
We meant
we
to
meant
say
like the
first
first
meeting.
meeting of each month.
No, the first Tuesday is our board meeting. The second Tuesday will be a live meeting. The third Tuesday will be a social, which, by the way, the one coming up, we're trying to get at Uncle T's. And the fourth Tuesday will be online. So look, you can mark your calendars, and as long as we don't have Mardi Gras, falling on one of our dates, everything will be following that pattern. Be aware that in June, we have a live visitor coming from the Sheriff's Department. Then we will have our banquet. And we've got, I understand already, a speaker for the banquet, and somebody had said something about someone who was going to be joining us.
I thought it was Lauren,
Lauren mentioned,
but she's gonna have the SL.
Oh, yeah,
Yes,
it's the
She
SLCC
invited her.
chancellor.
Yeah, she
And
invited
also Kaylin Jolivet, if there's any way she can, she's gonna also be at our banquet with her albums and all her pictures from Switzerland. And then regarding the school scholarships, we're working on all of that. Have a meeting with the SLCC coordinator. It'll be the second meeting tomorrow. The paperwork is in. I know that the two public schools know about finding our 3 candidates to be reviewed. I'm assuming that Donna is going to be talking to Turlings and getting their input from them. And then Joy and Donna and I will all hopefully be able to, cooperate as a team to help pick out who it is that ends up with the scholarships, and that the scholarships will be funded. Also, in touch with, this is something new, international, two things that are new. The International Festival International, there's a man named Scott Fallon, I think is anyway, he's the head of some of the beer booths and all, and he's asking for input. And I have mentioned that if we could get a team together to do one booth, but we do not want management, that somebody else should do that. So if we can get a team together, the Festival International starts April 27th and goes through the 1st of May. And that would be a way that we could certainly supplement our funding. Also, there's 2 or 3 different groups that have a give back where we may have a day that we can go and have people go, and it will add money into our coffers that will be dedicated. Tula Tacos has contacted me about this, but they haven't picked a date yet. Somebody had a question.
How much money are they gonna guarantee us if we work at the booths?
I didn't get an answer on that because they haven't responded to the option of us participating as a team.
They literally wanted us to manage it again.
I think so, but I would say, no, we can't do that. So find somebody else. Okay, and then the other thing is, as far as helping out internationally, the Foundation Disaster Relief Fund, if you want to help, that they are channeling funds to help Ukraine and all the different things, you know, in the United world. So be aware of that. If you have a penchant to help, it's always an option. And I'll find the link to do this, to make it easy. And we get mail too, you know, we get mail. I don't know about y'all, but I have these little envelope, this like file that's got all the Rotary Foundation opportunities. So what's on the horizon? Pets is going to be this weekend, our March social at Mr. T's, or Uncle T's. The 22nd, Shane Bernard is not going to be talking. That was what we were working on, but we're going to have Pamela Stewart, who's an ambassador for the Empowering Girls Incentive. That is an international effort for Rotary. And so she'll be addressing us online. So that'll be our virtual meeting coming up. And then, let's see. Okay, April 22nd, 21st, 22nd, the district conference in Homa. We do have some members. I know Danny's going, I'm going. Greg, are you going?
Oh, yeah, we registered, got our hotel.
Okay, okay. And then after that, then there's the June 4th through 8th International Convention that's going to be taking place at the George R. Brown Center in Houston. They did a really great opportunity to cut a little bit of costs. This last time it rolled back where it was $495 as opposed to $575, but it's back up.
But they only did that for a week.
They did it a couple of weeks, I think, or maybe even 3, where they rolled it back. It was in our information that went out.
You really ought to consider going.
It's an amazing
never gonna be
experience.
Cheaper than it is right there in
That
Houston.
close.
And until you go to one of these, you really don't have an idea of how international Rotary is.
That's so true.
You get to see people from all over the world and interact with them, and the speakers are fantastic. So I'll encourage you to go.
Yeah, it is. It's absolutely amazing. And so I second that. Is there anything else anybody would like to share? Well, I think we had a really, yes.
Marie, what hotel is the Homa conference at?
I don't know. I don't know, but I'll find out and I'll post it on the internet to all our
It might
members.
be.
Yeah,
a good deal, Minnie.
I think it is in DAC-DB.
It's what?
I think if you look in DAC-DB and the district information, it's probably there, but I'll
Well,
make
where-
sure to deliver it to the club.
Marriott Courtyard, Homa.
Marriott Courtyard Homa from Greg.
Okay.
All right, sounds good. All right, anything else? All right, do I hear a motion to adjourn? From Joy, second by Yolanda. Do I hear any objections? All right, then. Meeting adjourned.
All right.
Do you need somebody to talk to Festival International to?
I don't have that.
Anybody who knows the background on that, they need to be able to kind of give
I
them
don't have it,
guidance.
so send me a sheet or resend the
I
email.
put that in
I
a
don't have
little.
any, it's like a post river getaway, somebody's
Yes.
cabin, a camp.
Yes.
I don't have
I'll
that.
give them a call just to see what's going on.
You better know.
Report back to you.
Yeah, I think if we could have, you know.
I don't want to inundate our site.
Well, you can only post one per item.
Good experience for some.
But it would be good to have either a picture of the location
Who
or
do
if not,
you
I'll
think
have
would
to
be
go
the one
online
to
and try to dig up.
easy
Well, let's
compared
see,
to
this is-
organizing
Yes,
the whole thing?
yes.
But I'll follow
They
up.
send it to
I'll call him this
Outlook.
afternoon.
Greg,
And Scott being.
Yes.
Brother, cooking well.
I'm Greg Dot Landry.
That's great.
Okay.
He had a couple people.
No,
there,
but it was
he
posted
mentioned
that
him.
way somewhere.
He's
so it
actually
was
the
very
director
confusing.
of
That's why
festival.
you got so many
Okay,
people.
there was a lady that I talked to, whose last name was Harris.
This is
and
trash
like
can
she
on the way
was
out.
Diane Harris.
Right there.
Now Diane is kind of like the operations person.
I don't think I will care.
So she's probably above the peer Bruce and Scott's.
Maybe like what I did.
I'll call him.
That's me today. But I don't have it. Just hit resend.
$12 a meal, it's 24.
And I can check right now if it shows up.
And I think I'll look for that social night. If you take a check.
Absolutely,
I'll hit them quick one check. Usually that in the beginning.
yes.
Sounds like my dad.
Yeah, today is booked. Morning till about 8 at night.
Y'all let
Well, I hope it's not anything. we
No,
do.
it's just about once a month meeting.
So Mike, you and I have Twitter.
Exciting.
Yep, I gotta get you a letter though.
Yes,
Yeah.
please.
Well, you might go to another one, and you'll, so it's actually better
That
if
time of
you
year.
find that copy first.
Well, I think I got my last set of documents from work about my insurance coverage. Yes. Yeah, but now with your taxes, you gotta file proving that you have insurance.
Okay, thank you.
So,
Archie.
That didn't come
You've
through
been so
yesterday.
busy trying to input that.
It's a pain.
It is a big thing.
Say, so I sent you, we had a basket for like an old fashioned basket. You might be on that.
Oh, really?
An old fashioned basket,
Don't have that.
a bag with a beach bag.
Don't have that. It could be spam filter card, because I don't have any of them. Sheets, I need sheets.
Yeah, those
Okay,
forms.
well, I-
Forms.
So I didn't, I kind of did my own Word document, kind of, that kind of goes along with it.
It's got all the same stuff, that's all.
Yeah,
I
I
need.
just didn't want to send it back. like,
Anything
scan
you
it.
send me that's an auction item, resend.
Okay.
Well, at least those two.
And
Anything
resent, I
else?
sent it all, like everything that I sent you, because I
Okay.
swapped sources to.
Don't have that.
um,
That's great, though. It brings the numbers way up.
Good stuff.
Options. It's not getting my inbox